Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse talking to a patient on a general medical ward. Now read the question.
So, how are you this morning?
Not too good. I never seem to get a good night's rest in this place. I was warned that the tablets I'm taking for the back pain would make me drowsy, so I naturally thought they'd knock me out at night too, but no such luck, I'm afraid.
Oh, I'm sorry to hear that. How is your back?
Not as painful as when I came in. It's not that which stops me getting off, it's all the coughing and snoring going on up and down the ward. And it does seem to get worse after dark. I don't know why.
Well, maybe there's just less to distract you then, so you notice it more.
Is there something I could take?
It's probably better not to. But would you like me to find you some earplugs? They can help in situations like this.
Thank you. I'll give them a try.
Question 26. You hear a hospital pharmacist briefing a group of trainee nurses about the storage of medications. Now read the question.
All medicines on our wards and in our departments need to be stored safely and securely, and we all have a part to play in that. To be certain that medicines are safe to be administered, we must know that they've been kept at the right temperature. Nursing staff and departmental heads should be monitoring the fridges daily to ensure these are fully functioning. I regularly audit the temperature logs in my clinical areas to check that medicines are being kept properly. The storage and use of controlled drugs are bound by legislation. This requires us to demonstrate that they're kept securely, stock levels are correct, and each administration is accurately and clearly recorded. Therefore, pharmacists have to monitor controlled drugs every 3 months to check stock balances and that all entries in the controlled drug record book are legally correct and legible.
Question 27. You hear a nurse talking to a colleague about a patient who's just had hip replacement surgery. Now read the question.
The doctor says we're aiming to send Mrs. Tompkins home by the end of the week. The notes for what she should do when she gets home need preparing at some point. But let's see how she gets on in the next day or so before worrying about that.
Has she managed to get out of bed yet?
The therapist is coming in later to introduce her to the walking frame and see if he can get her to take a few steps. You can help if you're still on duty then.
And is the pain under control?
Pretty much. We haven't had to increase the dosage. She's been told to flex her ankles and contract and relax her quadriceps when she's lying in bed, and that this should be done fairly frequently. I'd prioritise seeing how she's getting on with that because she's complaining about it a lot.
Question 28. You hear 2 doctors discussing a female patient admitted with suspected meningitis. Now read the question.
So we admitted a young female student earlier, the one with severe headache and aversion to light.
Yes, she's pretty poorly. Are you thinking it's meningitis?
It's a distinct possibility, but we'll have more idea after the lumbar puncture results. She's quite sleepy, but still able to communicate, and doesn't seem to think she's been immunised against the disease.
No, she's been travelling abroad, so she may not have been aware of the need. And anyway, if this is the new Y strain we're looking at, she might not have been protected anyway.
Yeah.
But she'd apparently called her mum, who realised what was going on and called an ambulance. Another few hours and we could have been looking at a very different outcome.
Yeah, I fear so. Anyway, she's on antibiotics and antivirals until we know what we're dealing with.
Sure.
Question 29. You hear a GP talking to a patient about a diagnosis of pituitary adenoma. Now read the question.
You've had the results of your tests, and as you know, pituitary adenoma has been confirmed.
Yes, the endocrinologist explained that it's why I'd been getting such excruciating migraines over a long period, and that it also explained the bouts of nausea. I was initially quite relieved, actually, because, as you can imagine, I thought the worst, that it was a malignant brain tumour. But once I got over that fear, I realised it wasn't plain sailing by any means, and they'll have to get me in for an operation quite quickly because the growth's pressing on my optic nerve, and I am horrified at the prospect of not being able to see.
I understand.
The endocrinologist said there were really effective treatments, so I really want to find out what the options are.
Question 30. You hear a hospital administrator giving a briefing to new staff on the subject of patient safety. Now read the question.
In this hospital, we work as a team to investigate all serious clinical incidents, and falls are a main component of these. Compared to the national average, we're relatively good at preventing falls, but that can easily change. So when falls do occur, it's my job as Head of Quality and Safety Governance to ensure that causes are investigated and lessons learnt, so that action to prevent further patient falls can be implemented. We've established weekly patient safety summits every Tuesday at 1 p.m, where clinical leads discuss serious incidents openly and without blame in order to learn lessons and implement measures to keep our patients safe. I'm now going to hand you over to Dr. Sahota, who's the clinical falls lead tasked with improving quality and safety around this issue, to hear how this works in practice.
That is the end of Part B.